As we continue coverage of Men's Health Month here on 21 News at 5, we're talking about what might be a sensitive subject for couples that are trying to get pregnant. That is male infertility. Dr. Scott Lundy joins me today. He's the head of reproductive urology at the Cleveland Clinic. Dr. Lundy, thanks for joining us.
Sure, happy to help. Nice to be here.
So I understand this is a common problem among men. However, they just don't get tested. So what kinds of tests are out there they can undergo?
Yeah, this is about 1 in 6 couples that struggle with fertility problems, and about half of them have a male factor. And if we don't talk about infertility, we really don't talk about the male side of things. And so workup for these patients and understanding exactly what the problem could be is very important. We start with getting to know the patient, asking some questions, maybe making some bad urology dad jokes while we're at it. And then we do some basic testing like blood work, and then also a semen test, which allows us to assess how many sperm are present and whether they're swimming or doing their job or not.
What's kind of the perception out there? Is it when couples are struggling to get pregnant, is it always, oh, it must be the woman, the female?
I think the first step is to recognize that it takes 2 to tango. And yes, most couples start with a female workup, but at the end of the day, the male factors contribute a significant amount. I think the biggest challenge we face is that there's a stigma associated with infertility as it relates to manhood for many men. And so there's shame or sadness or depression that's related to this. And I think if we talked about it more and recognized it as a condition like any other in medicine, that we would have a lot more couples come in and receive the care that they need.
Are the tests to find out if a man is fertile or not, are they invasive?
No, the majority of the first round of testing, things like an ultrasound, a semen test, some basic blood work are very safe, very benign. There is, of course, an awkward aspect of providing a semen test, but this is done in a professional way in a lab that specializes in this area of testing. So there's really no risk to having those things done other than the importance of finding the information out.
What are the solutions and treatments that can maybe help men and couples who are experiencing infertility? Can that be reversed?
Absolutely. There are probably 100 causes of male infertility that we know of, and probably another 100 that we don't, or more. And so it really depends on what the cause is. The most common reversible cause is something called a varicocele, which is a dilated set of veins above the testicle. And in men who have a varicocele, we can significantly improve their fertility with a minor surgery. For other couples, they may have a history of a vasectomy, and so we can provide a reversal for them and restore their fertility and allow them to have a child. And then yet for others with severe male factor infertility, oftentimes we do a surgery where we go into the testicle surgically and look for individual tubules that contain sperm, almost like looking for a needle in a stack of needles. And if we find it, we can help them with IVF or assisted reproduction.
My guess is technology has advanced in this pretty far in the last few years or decades?
Absolutely. Yeah, there's a great role in our field for microscopic surgery. There's a role for AI in the coming years. And in fact, infertility was one of the first users of AI for computer-assisted semen analysis. There's a role for additional research mining and data analysis to look for new treatments for fertility. This is really a moving target, and we're trying to stay ahead of it as much as we can.
Finally, any other message that you would like to share on this subject?
Yeah, I think it's important to recognize that it's okay to talk about this. Your friends are going through it too, and if you talk about it and learn from each other and support each other, then you'll have a much better path through what is a difficult and trying diagnosis. But it's important to know that we're here to help, and we're always happy to evaluate you, even if we're not sure there's a male factor present. That's our job. So come and see us. We're happy to help.
Yeah, and as you mentioned too, if we can reduce that stigma, hopefully we can get more people to talk about it. So Dr. Lundy, thank you for joining me for this important conversation. We appreciate it.
Absolutely. Have a great day.